At the outset, I'd like to thank International Uveitis Study Group for giving me this opportunity to talk on histopathology and molecular biologic study of viral retinitis. I'll be talking on acute retinal necrosis, cytomegalovirus retinitis, progressive outer retinal necrosis, Chikungunya retinitis, Dengue retinitis, West Nile virus retinitis, histopathology and molecular biologic aspects. Acute retinal necrosis had characteristic clinical picture comprising of the necrotizing retinitis in the periphery, vitritis, retinal vasculitis. This is a montage fundus picture showing peripheral necrotizing retinitis. In 1982, Culbertson et al. Described the histopathology and etiology of a case of acute retinal necrosis who, after 18 days after the presentation, the eyeball was available, and the histopathology here showing the inflammation of the iris and ciliary body. And there is the optic nerve lesion showing the chronic inflammation of the optic nerve with the necrosis of the retina overlying it, and there is the occluded blood vessels with chronic inflammation surrounding it. And here is the showing necrotic retina with complete loss of retinal architecture, and there is the inflammation of the choroidal vessels with thrombosed retinal vessels. And here is the full thickness retinal necrosis with the sharp demarcation line between necrotic and non-necrotic retina, normal retina. And there is a diffuse infiltration of lymphocytes in the choroid is seen. And this slide is showing eosinophilic internuclear inclusions seen on the section to the retina. And there is a total necrosis of the retina with inflammation in the choroid as well as the overlying sclera. Here is that episcleral vessels surrounded by the mononuclear cell infiltration with areas of retinal necrosis is seen. And electron microscopy showed herpes group of virus particles amid the cellular debris. And higher magnification showed internuclear inclusion shown in the arrows. And there's the envelope extracellular viruses were seen adjacent to the rod cytoplasmic membrane. We did a histopathologic and molecular biologic study of an eyeball of a case of acute retinal necrosis, and we found there is a chronic non-granulomatous inflammation in the retina with occluded retinal blood vessels and herpes virus inclusion bodies. Nested PCR was positive for varicella zoster virus, and the histopathology on immunohistochemistry showed CD3 positivity, the T cells seen on in chronic inflammation. We did the acute retinal necrosis, histopathologic molecular biologic study and immunohistochemistry, which showed histopathology chronic non-granulomatous inflammation in the retina with occluded retinal blood vessels and herpes virus inclusion body. Nested PCR was positive for varicella zoster virus. CD3 positivity was seen on immunohistochemistry. This is a photograph of the other eye showing acute retinal necrosis in the periphery. And this is a histopathology showing the peripheral retina, showing chronic inflammation with occluded retinal blood vessels, which is seen on the higher magnification. The inflammatory cells were CD3 positive, there is a T cell positivity. Viral inclusion bodies were seen in the sections, and the nested PCR and real-time PCR showed herpes zoster virus DNA. Cytopathology, the vitreous specimen in acute retinal necrosis demonstrated a lymphocytic response with histiocytes, macrophages, and polymorphonuclear leukocytes. The studies suggested that both innate and adaptive immunity are responsible for the clinical disease findings. And here is the slide of the cytopathology showing that the hematoxylin eosin stain, infiltration of the lymphocytes and macrophages. Macrophages were seen on immunohistochemistry with CD68 positivity, and T cells predominantly seen with immunohistochemistry with CD3 positivity. Sparse B cells were seen, which are CD20 positive. And there's a cytopathology of the vitreous specimens showed collection of lymphocytes and macrophages. We did the correlation of quantitative polymers chain reaction with clinical characteristics of patients with viral retinitis. We found that the DNA copy number significantly correlated with the extent of the clinical involvement. Real-time PCR was useful in confirming the viral etiology in over 50% cases of suspected viral retinitis. It correlated with the extent of the clinical involvement and the timing of the sampling. This is a case of acute retinal necrosis with three-quadrant involvement of retinal necrosis, and real-time PCR showed 47,723 copies of the DNA. Non-necrotizing herpetic retinopathy. This is a 59-year-old one-eyed man came with sudden blurring of vision in the left eye for 5 days. He lost his right eye 40 years back, and there was a granulomatosis precipitation in the anterior chamber, and there is a retinal vasculitis with retinal infiltrate. Anterior chamber tap was positive for the herpes simplex virus type 2. Real-time PCR showed true crore 83 lakhs 1,985 copies of the herpes simplex virus DNA. CMB retinitis has got characteristic picture with a granular whitish patch, necrotizing retinitis with hemorrhages, perivascular distribution, sharp granular border, and often giving rise to the pizza pie appearance. And untreated end-stage CMB retinitis showed extensive retinal thinning with gliosis and sclerosed vessels, optic atrophy. Here is an autopsy eyes of CMB retinitis, and you can see that full thickness retinal necrosis with sharp demarcation between the non-necrotic and necrotic retina. And higher magnification showed cytomegalovirus inclusion bodies seen within the necrotic retina as well as in the retinal pigment epithelial cells. Progressive retinal necrosis comprises of multifocal necrotizing retinochoroiditis, which begins in the posterior pole and spread to the peripheral retina. There is an absence of vascular inflammation, minimal retinal hemorrhage. Optic disc can be involved with papillitis or neuroretinitis. There is no anterior chamber or vitreous reaction, no vasculitis, optic nerve involvement, and poor response to the treatment. Varicella zoster virus was postulated to be the causal agent. Close temporal association with the cutaneous zoster has been found. Cytomegalovirus we have found in the vitreous humor of one patient of progressive outer retinal necrosis. Here is a case of progressive outer retinal necrosis showing the necrosis of the retina from the posterior pole to the periphery with sparing of the vessels. An agarose photograph showed amplified product of the varicella zoster virus in the anterior chamber tap. And this is a case of where cytomegalovirus detected from the vitreous humor in a patient with progressive outer retinal necrosis. In case of molecular diagnosis and ocular imaging of West Nile virus retinitis and neuroretinitis, which has been described by Dr. Ratnam Shivakumar from Madurai, and there is a retinitis, retinal vasculitis, and neuroretinitis seen, and there is extensive retinal vasculitis seen in the fluorescent angiogram. And optical coherence tomography through the retinitis patch showed hyperreflective inner retinal layer, demonstrating inflammation of the superficial retina. And here is a case of acute neuroretinitis with macular star, which resolved with treatment. And there is a combined central retinal artery and vein occlusion in a case of West Nile virus infection. Dengue retinopathy, there could be anterior chamber inflammation or vitritis, chorioretinitis or hemorrhagic retinopathy, chorioretinitis with maculopathy, focal chorioretinitis or choroiditis, retinal edema, vascular sheathing, retinal hemorrhages, foveolitis, cotton spots, neuroretinitis. Here is the case, image courtesy of Dr. Padma Malini from Bangalore. This is a 21-year-old female with blurring of vision on the left eye for 3 days. History of fever, vision right eye was 6.6, left eye was 6.24, and you can see the retinal vasculitis with retinitis with hemorrhages. Optical coherence tomography showed hyperreflectivity in the outer plexiform layer, Henry's layer, and outer nuclear layer, which ultimately localized disruption of these layers. And this the dengue IgG was positive in this case. Post-treatment optical coherence tomography showed resolution of dengue foveolitis lesion. One-step real-time RT-PCR assay can be done to the serotype dengue virus with clinical samples. Chikungunya retinitis can present with mild vitreitis, retinitis with or without macular star, retinal hemorrhages, retinal edema, multifocal choroiditis, neuroretinitis, optic neuritis can resemble Weissenal virus retinitis or herpetic viral retinitis. Real-time quantitative polymerase chain reaction in the diagnosis of viral retinitis is quite useful. This is one of the example of a 48-year-old male came to our institute with gradual progressive dimness of vision both eyes since 15 days. Only history which was giving the patient was history of fever 3 months back. Fundus showed the multiple areas of retinal exudates with hemorrhages. And we did the PCR for all viruses. Chikungunya came with 9 copies of the Chikungunya virus. And the patient was post-treatment with the steroid, showed complete resolution of inflammations with the hemorrhages and exudates. The vision improved. Clinical pathological study of retinal and choroidal biopsy in intraocular inflammation can be done in diagnostic dilemma. And this is a series of endoretinal biopsy of 24 cases where electron microscopy, in situ DNA, and polymerase chain reaction was done. Viral retinitis was identified in 53% of the cases, which comprises of the CMB retinitis, ARN, and progressive outer retinal necrosis. This is a case which was initially diagnosed as cytomegalovirus retinitis. When the patient was resistant to the treatment, retinochoroidal biopsy was seen. And here is the retinochoroidal biopsy showing necrotic retina with Toxoplasma gondii cyst. Electron microscopic study showed Toxoplasma gondii bradygioids. Polymerase chain reaction-based assays of the vitreous samples can be used for the diagnosis of viral retinitis. This is a study of 37 patients of 38 eyes. 24 patients, 63% had viral DNA. CMB, 11 patients. VZV, 8 patients. Herpes simplex virus, 6 patients. 13 patients did not have any viral DNA. A new era of uveitis has come with the usage of multiplex PCR and real-time PCR. This is a slide from Dr. Mochijoki, and here is that 12-tube multiplex PCR strip coated with the primers can detect, distinguish between the fungus, mycobacteria, and virus at one go. In summary, the histopathologic studies provide correlation with clinical features, helps to understand the etiopathogenesis. Molecular biologic study of intraocular fluids in viral retinitis is helpful for diagnosis. Real-time PCR correlates with extent of inflammation. Endoretinal biopsy can be done to clinch the diagnosis in recalcitrant cases and in diagnostic dilemma. Thank you for patient hearing.